Cornwall was shocked on the weekend by the news that a number of Canadian citizens returning from the quarantined Diamond Princess cruise ship would be housed at the NAV Centre. A press conference was held on Monday afternoon to update residents and quell concerns.
As we bring home Canadians from the Diamond Princess cruise ship, we are taking every precaution to keep them and this community safe and healthy. First, no passengers showing symptoms of the coronavirus or those who have already been confirmed to have it will be allowed to board the plane. Anyone exhibiting symptoms will instead be transferred to the Japanese healthcare system to receive appropriate care. Any passengers who begin to show symptoms during the flight home or upon arrival at CFB Trenton will be assessed and transferred to a local hospital in Trenton. All remaining passengers will be transported to the NAV Centre to begin 14 days in quarantine out of abundance of caution. Quarantined individuals will be asked to stay in their room for the duration of the quarantine period of 14 days, with the exception of access to outdoor leisure time on a daily basis with specified boundaries and at specific times. They will be asked to maintain a 2-meter distance from others and to wear a mask and gloves while outside. The Government of Canada has made arrangements for 24/7 security within the lodgings at NAV Centre, including controlling access in and out of the buildings housing individuals under quarantine. At no point will the general public have access to or be able to come in contact with any individuals under quarantine during their 14-day stay at the NAV Centre. Individuals who are providing care or support to repatriated Canadians will follow established infection prevention and control protocols to ensure their safety and to maintain the safety of the community. As a result, they will not pose a risk to the local community of Cornwall or others when coming and going from the centre.
The Eastern Ontario Health Unit has been working closely with NAV Centre and federal health authorities, and Medical Officer of Health Dr. Paul Rumiliotis says that he believes there is little risk to the general public.
When I found out about this on Saturday, I immediately thought myself, how's it going to be housed and what's going to happen here, knowing the facility. I was quite relieved yesterday. I walked around with our infection control manager from the health unit to look at where the pod is going to be. This is a completely isolated building. It's only connected by a tower and a tunnel. And so looking at the way that that the quarantine is going to be set up, looking at the way the emergency medical assistance team from Ontario is going to be set up to provide on-site services, I can tell you that I'm very comfortable, as is my team, who are infection control experts, that the procedures are in place will adequately protect the passengers coming from abroad, but very importantly from staff at NAV Centre and obviously the Cornwall and the surrounding area. I am very confident that the screening process that was done, and based on the experience in CFB Trenton, we will be getting people that are not ill. If they do require medical assistance, they will, non-related to CONV. They will get it on site. If they develop symptoms, we have protocols in place.
NAV Centre itself only found out about the plans late Saturday evening, but they are confident that the measures being put in place will ensure no risk to staff.
Up until Saturday, I think there was a conference call at 5. There was no discussion about it ever happening here, confirmed. At 5 until 7, there was a lot of conference calls back and forth. A lot of people got involved. But there was no agreement in place at that time, and we were under the impression that ongoing discussions would happen the following day. What we experienced was a media release. Probably shocked us as much as anybody else, because at that time there wasn't a clear direction on this. There was discussions started but not fully completed.
Based on the information that we've received, from Public Health Agency of Canada and also from Dr. Paul here, we are confident that the main building at the NAV Centre, that there is a very low risk to anyone who is using those facilities. The health and well-being of our employees is a top priority, so if any of our employees are feeling that they want to discuss this, they should of course speak to their manager, and we'll have an open discussion about what can be put in place.
Mayor Bernadette Clément began the proceedings lamenting the lack of communication between the federal government and the city. but stated that it is time to move forward and that both she and the city are working to keep lines of communication open so that residents have adequate access to information.
I have been working very hard with city administration to make sure that we're getting communication from the federal government agencies involved directly to the citizens of Cornwall. So this press conference is really about making sure that this is going to happen on a regular basis, that the people of Cornwall will have direct contact from the federal government agencies that are the lead agencies on this matter. Cornwall did not get to choose that this quarantine take place here, but we do get to choose how we react to this. And so I can say what we know now is that city officials are being briefed regularly. We're working with our MP, Eric Duncan, to make sure that proper channels of communication remain open. And I am taking in lots of information. I'm getting, as you can imagine, lots of emails, lots of reaction on social media, and I'm making sure to channel all of those concerns and comments to the federal agencies who will be dealing with this and who will be answering the questions of the people of Cornwall. I'm reassured by this press conference. Going forward, I think that there is going to be better communication.
Reporting from the NAV Centre, I'm Gabriel Riviere-Reed for your TV.